bill has been passed, it's law. But to me, 90% of the interpretation is yet to occur.
My colleagues in the field are preparing for the reform that they see on the horizon with a 3 to 5 year window. They're preparing for cutbacks in funding. They're preparing for layoffs if they haven't already occurred, because they don't see what's going on nationally to be affordable, and they think there's going to be a recognition of that as the implementation of this law goes in, that there's going to be tweaking and reduction of revenues. It's inevitable, because we can't afford what we have now. We can't afford what's laying out there in the future.
And having to learn to live on government payer margins or lack of margins is going to be a shock for hospitals and health systems around the country.
Mm-hmm.
And you're going to have to behave differently.
The fact of the matter is, over the decades that we've all been engaged in this, we've seen a lot of the reform come, and we've continued to see more and more money spent on health care, and we've continued to see the health of the American people getting less and less healthy.
There will be a temptation to overregulate, because the cost curve, it's got to bend.
Right.
So let's regulate the heck out of it. Let's get Machiavellian in terms of cuts and penalties and ways to really quickly reduce the dollars. But the innovative side, it's going to take time, but ultimately it's going to create a redefined kind of health system that perhaps can keep that cost curve bent over time rather than short term.
There are people in business, in any sector of business, that can see the opportunity in everything. And they're the ones that prosper.
That's right.
And the ones that don't prosper are those that say, how can I hang on to the way it used to be, and the way I used to get paid, the way customers used to respond to how can I hang on to that? They're not going to go anywhere. It's got to be, how do we create a new kind of leadership to deal with this environment?
So